store. They can make you sick, they can make your customers sick if they don't know it. If we can do things like that, continue to this meticulously wash our hands, social distance ourselves, and like I said, don't work sick. We can manage this. You're asking me to predict the future that I number one, don't want to see happen, and number two, can't predict. But I can tell you from the examples of Italy and New York, this can get exceptionally ugly in a hurry. And that's not something we don't have to do that. I said this 6 weeks ago when I was in front of everybody. This is totally in the control of the community. Totally. We can provide capacity so long as the community works with us. When you really look at what a health system can do to manage the health of a community, we're responsible for about 15% on a good day of what it takes to manage the health in the community. We can provide the direction, we can provide the providers, we can provide resources. 85% of what happens in a community to manage its overall population's health is the responsibility and actions of the community. And that's why we're here pleading with you today. I mean, we're not asking you to do anything painful. We're not asking you to do anything expensive. We're asking you to do something different for a relatively limited period of time that should get us in a different position on this curve.
So if I'm understanding you, sir, before I let you go, you're saying you Prisma Upstate Health cannot give specific numbers to beds, to ventilators, to staff, to capacity, because it is always fluctuating. Am I understanding that correctly,
That's fair.
sir?
That would be fair. What I can tell you right now is the rate of rise is going, with this rate of rise, our capacity declines every day across the entire upstate. And it's at a rate of rise that we're seeing inside of Prisma, Bon Secours, ANMed, Spartanburg, we talk at a minimum of once a week. Our capacity is rapidly reaching its limit.
How close are we? If it continues, if nothing changes, if no one masks up, how close are we?
We could probably hit the limit of our capacity in 2 weeks.
Thank you, Doctor.
Like I said, this can be turned around inside of a week.
Dr. James Brown with the Greenville News. Can you give us any numbers on how many patients are hospitalized and how that's gone up in the past week, past month?
I can give you general numbers in our facilities. If you look at Prisma as a whole, today we probably are over 300 patients in the system. Well over, and this is going to rapidly continue to rise at the rate of rise we're seeing.
300 system-wide for Prisma.
System-wide, not upstate in the Midlands. Okay, that's
the question I want to ask you is this an airborne pathogen, or is it just something that people spread from person to person to person?
It's not airborne, it's droplet. It's spread by droplets. Like if you sneeze on me, I will catch it from you because you sneeze droplets on me.
Well, let me ask
and
you
it's
something.
spread by contact, person to person.
Well, you know we had the flu epidemic one time, right?
Yes.
Is this the same thing as that?
It's a different virus than the flu, but it's spread very similarly.
So how are y'all going to stop it?
You see that mask? You pull it up over your nose, and that helps stop it. This is the treatment for it. It's a mask and washing your hands with hand cleaner.
So we got to walk around like this all the time.
Okay. The one thing I would like to say that I haven't mentioned, we have several things over the next several months that are going to make it more and more critical for us to manage this disease. We have endemic disease in the community that we must deal with, and that takes up a significant amount of the overall capacity upstate. We have flu season on its way. It is imperative that we get this controlled before we get those two things stacking on top of COVID. So we need all of the community to get, as many people as will vaccinate need to get a flu vaccination this year. All of us are doing the best we can to supply that.
I've heard you say a couple of times that you would like for municipalities to require, everyone to wear masks within their municipality. You talk about cities, you talk about counties. Mayor, is there any possibility for you and City Council to decide, here in the city of Greenville, I know you can only speak for the city, not for the county, is there the possibility to pass something to require everyone to wear masks? I know we have the pharmacies and the grocery stores, but it sounds like from what you're saying, you want municipalities to start taking charge on this.
Somebody's got to. And I think the mayor has done a very good job moving forward with the masking ordinance. We need to move forward beyond that. Like I said, we don't have to, people, we don't need an ordinance to do what we need to do for one another. We don't. We just need to understand why we do it and to do it. A mask this is the most effective treatment combined with hand sanitizer, combined with all the other things we've talked about with social distancing, do not congregate in large crowds and don't work sick. That's the treatment for this problem. We're not doing it. That is why we're seeing this get out of shape.
Mayor, would you mind addressing that? If people aren't already doing it.
We're just the city of Greenville. We're a small dot in a county of 500,000+ people. It's very clear from what Dr. James said, what you heard today. This is much larger issue in the city. We've done our part. We could indeed do more. I hope we do more. And I particularly, again, want to commend, as I did in the beginning of the news conference, when I started out by commending Publix and Harris Teeter and CVS and Walgreens. What they've done is a tremendous public service, and I hope it gets more people in the habit of wearing a mask. But there's still others in this community we need to be talking to. And I would frankly argue that what the big retailers do is probably far more significant, far more effective, and far more impactful than anything a city does in South Carolina. So we need to kind of change the direction in that discussion. But I appreciate what Dr. James said today. We all have a part to do.
Right, but on a Saturday or a nice day like today, when you see people crowding the streets, although outside, sometimes social distancing is really not possible on our sidewalks.
I'm thinking, let's really get back to what we're hearing today. We're hearing today, let's focus on what's important. Walking around here on the sidewalks, not a big deal. Walking in the park, not a big deal. What's a big deal is going to a bar or being in a group of people of 25 or more. I think we heard it over and over again. That's where we're seeing the actual cases. And frankly, also, going to places where, again, you're in an inside environment, like in a pharmacy, in a drugstore, that kind of thing. I mean, that's really where it's serious, and that's what people need to focus on. Thank you.
Couple quick questions. This is Michelle Zhu with Fox Carolina. Is there a potential for a mandatory mask order?
Well, you're talking to the mayor of the city of Greenville in a county of 500,000. So what we've done our part. People in the city, I think we could do more in the city, but that's not the issue. The issue is the county. The issue is the state. The issue is what the big retailers have done. The issue is what all of us do with this mask. So again, I think that's the bigger question here today.
Thank you.
Thank you.
And maybe this is for one of the doctors. What would you say to people who say masks don't work?
So I would actually say this is the least expensive way to save a life there has ever been. We spend a lot of money and resources saving lives in healthcare. This alone will save a life. If people don't believe us, you can go to the PBS website. There's a video that's why masks work. It's very clear and shows you whether it's a N95 we use on the front lines, a procedural mask, or Saw Plus. It shows you exactly why they work and the science behind it.
Could we see any changes potentially affecting bars, restaurants?
I think the governor's already, he signed his ordinance that no alcohol after 11 o'clock. But, I'm going to go back to what the mayor said and what Dr. James said. Legislation is not the answer. This is a personal responsibility, a social responsibility for a public health emergency. We don't need cities, we don't need counties. They shouldn't have to take those measures. We should be able to take care of each other, simply by doing the things we've been outlining for months. It shouldn't have to come to that.
Thank you.
I have a question for the mayor. Mayor, you were on the Accelerate SC panel. The governor's been at those meetings. Should the governor pass a statewide mask law at this point?
Oh, yes, my personal opinion, I think the position of the city of Greenville, because we passed an ordinance, I think that kind of speaks for itself. We wouldn't have passed an ordinance for the city if we didn't think it wasn't a good idea for the county, if we didn't think it was a good idea for the state.
Right, Mayor, but the ordinance here in the city doesn't extend to all public places. It only extends to grocery stores and pharmacies.
In consultation.
There are other cities that have passed citywide ordinances where you go to and everyone walking down the street is wearing masks. So I know we're saying we don't want to have to pass a law to do this, but if people aren't taking their personal responsibility seriously, it's up to you.
Please ask that question to the county.
But it's up to you
and
as our
others.
elected mayor also to take further steps. No,
we were the first ordinance, and I think we had an impact we wanted to. One of the first phone calls we got a week after the passage of the city ordinance was from a manager of a grocery store in the county. And you know what he said? He said, thanks, even though it doesn't apply to his store in the county, he said mask wearing was up 3 or 4 times. We had an influence. And at the end of the day, we're trying to send a message as much as anything else. Get people in the habit and the consistency of using it. And that's why I think, again, what the big boxes have done now in the pharmacies is so important, because I think it's not just what happens when someone goes to Walgreens. It puts someone more in the frame of mind and the habit to be mindful of this problem, because as he said, it's really, you shouldn't have to legislate these things. You sometimes have to, but to a large degree, you're just trying to send a signal and get people in a habit. And that's what we've been about. But to answer your question, yes, the city of Greenville is probably going to take additional action. My point, though, is that's not what we're really talking about today. We're talking about something much more significant, and thanking those people who've done that. And we still have others out there. I mentioned early on, I told you, Home Depot and Lowe's, they benefited mightily during March and April, did they not, when they were open and other people were closed? It's time for them to take action, for example.
We've received a question about why I can stand up here and preach at people without a mask on. One of the problems we've had is it muffles what we're trying to say when you're in front of a microphone, and so we either pull them down or take them off while we're in front of a mic. It's not because we're not going to wear a mask. So even though we look a little hypocritical when we don't have a mask on up here in front of everybody, this is because we're trying to make sure you hear clearly what we're trying to say, especially when we're in an area as active as it is behind me.
Doctor, if I may, I just want to clarify that I heard you correctly earlier in your statements. I'm trying not to adjust this mic because I'm on the taller side. Did I accurately hear you, sir, that you recognize you are not an elected official, but as your medical opinion, if you were in charge, you would close bars and beaches? Did I hear that accurately, sir?
Yes. If I was the king of the world, we would all be avoiding bars, beaches, and boat ramps right now.
If you were in charge, is there anywhere else that you would add to that list, or if I may...
No, like I said, if people will do what we're asking them to do, and the reason I say those three, there are 3 areas where you can't wear a mask. You can, but you can't really wear it in an effective way. And so when you have situations where you have a conflict with what your primary preventative measure is, you have to avoid those. But to your point, no, the only thing I can tell you is if we take the responsibility on ourselves to be cognizant of the health of all of us, of everybody, and ourselves, and we act responsibly, which is all we're asking us to do. The mask, to Marcus's point, we are saving people's lives. There are a lot of people that have died with this disease, and if we put these masks on and wear them like we're supposed to wear them and take responsibility for one another's health, then we can make this better, and we can turn these curves around, and we don't have to worry about capacity at that point, we hope, and we don't have to worry about people dying that didn't have to. So, yeah, like I said, areas where you cannot wear a mask or use preventative measures appropriately, or you're going to be forced into tight areas and congregate unprotected, you need to probably do something to limit that.
Thank you for your clarification, Doctor. Citing your medical expertise, recognizing you are not a public official.
And I'm not king of the world.
And you are not currently king of the world.
So.
Sir, on your medical opinion, would you recommend that families send their children to a face-to-face school, currently understanding that things could change, but as we sit here today, what is your message to families wondering whether or not they should send their children to in-face, person-to-person schools?
What I would tell people today is if you can get it, if we'll all put our mask on, we'll all do what we're asking everybody to do, meticulous hand sanitizers, wash your hands. If you think of washing your hands, go find some place to wash them. If we will do those things, we make him get back into school the way we want to go. But if we refuse to do what we need to do to take responsibility for one another, then it's not my call, but it's going to make probably doing things like that difficult.
Thank you, sir.
Time for one more question.
Doctors, any one of y'all. This is Andrew Garrett from WYFF. I've tried to get this answer for 5 months now. Asked DHEC 5 different times. Can any of y'all answer how accurate, percentage-wise, are the tests that you're giving for COVID-19 specific? Not picking up flu, not picking up that. What is the actual accuracy rate of the tests?
Andrew, so there are probably over 100 tests out there, and they all have different performance characteristics. The tests that we're specifically using within the health system have sensitivity rates, which means how accurately it picks up the disease, between 95 and 97%. And that's what the manufacturers published. But there, as I said, there are hundreds of these tests out there. So if you ask a question of someone else, they're going to potentially provide you with a different number. Thank you.
Well, thank you for your lively engagement in this in this very important news conference. Thank you for being here, and thank you particularly to Dr. Blackstone, Dr. Osmond, and Dr. James for delivering their sobering message and something everybody needs to hear. So thank you very much.